Well, welcome to a couple of things I was going to do on the end of the last video, but it overran slightly. So there's a new clinical feature of COVID-19 has been identified by the COVID Symptom Tracker app. So I want to look at that, and it's not really a surprising feature. And then we'll do a brief update from the United States. A couple of interesting things going on I just want to comment on and leave questions about. Today's theme seems to be arguments on both sides. So anyway, we'll come on to that. But there's no argument about this one. This one's based on good data. Now, we know, of course, that when older people especially and people that are frail get sick, they don't have the mental reserve, reserve brain function that you and I might have. So when they get infections or when something goes wrong, they can get a state called delirium. Now, this delirium is an acute confusional state. It can look a bit like dementia, really, but the difference is that dementia is irreversible. I mean, by definition, dementia is an irreversible impairment of intellectual function. Whereas delirium, if you correct the cause, if you correct the thing that's knocked the brain function off, the delirium goes away again. Mostly, it's very often an infection, but it could be anything. It could be trauma, it could be constipation. It's anything that goes wrong, really, with an older, frail person. But infections are a common one we see all the time. So you can go home one evening and an old frail person at work might be having a lucid conversation and chatting with you, and you can go in the next morning and they just seem completely confused, completely away with it. Then that acute deterioration makes you think, this person is delirious. What has caused this acute deterioration? Work out what's caused the deterioration, treat that underlying cause, and the person can go back to being their own usual self normally within a few days of treatment, typically. So it's reversible. But in delirium, you get a clouding of consciousness, you get reduced attention, you can't keep the person's attention. They're disorientated for time, place and person. They might not know when they are, they might not know the day, the month, even the year or the decade. They might not know where they are, they might think they're at home when they're in hospital. And they might not know who I am as someone caring for them. They might think I'm their son or something like that. Disorientation for time, place or person. They can have illusions, which is a misrepresentation of external reality. They can have hallucinations, which is a perception without an external stimulus. And they can have difficulty in speaking. And this picture of being confused, so it's not surprising that this has been picked up. Now, interestingly, it is not on the Centre for Disease Control list of symptoms. So we know from COVID Symptom Tracker data that very often the first features of this in most people are undue fatigue and headache. So they are now on the CDC website. But of course, we know the fever, the chills, the cough, all those things we know. So they are there already, but this is in addition to those features. So let's look at them now, what they are. There we go. So delirium, new clinical feature. This was identified on the 5th of October. Now, this is a key sign in frail older people. So this is not really going to occur in younger, fitter people. It's frail older people who don't have the reserve mental capacity. Now, they looked for this study at 322 patients admitted to hospital, 533 patients who filled in the COVID Symptom Tracker app and who also tested positive. Now, the important thing here is with the COVID Symptom Tracker app, for frail elderly people, they might not be able to use the app themselves, but relatives can log on their behalf. Same for children. So I think it's a very important point to note that if you work with a frail elderly relative that you know or who lives with you or whatever, or children, do enter their information onto the COVID Symptom Tracker app, because it's vital to get information from people who can't enter the information themselves. Very important point there on data gathering that we can all take part in, essentially, as citizen scientists. Everyone has the opportunity to help and contribute here. So we've got this state of confusion, this delirium. Now, this is associated with a higher risk of serious illness and death. So we need to know about it for the well-being of the individual, because they are at greater risk. And we need to be aware of delirium as a possible early warning sign in the elderly. So if you work in an elderly care facility, for example, and an older person becomes acutely confused, you can recognise delirium. You think, is the cause of that delirium COVID? And you want to isolate these people from the rest of the residents or the rest of the patients until a diagnosis can be made. There's a massively important point here, because in the early stages of this pandemic, there were so many tragic, unnecessary deaths in care homes. There's no question about that. And part of the defence now is this early warning, recognising someone who might be infected as early as possible, isolating them. In addition to the headache and fatigue as early features, we now have delirium in the frail elderly as a possible early warning sign, meaning that we can take appropriate action. So delirium, tiredness, breathlessness are more common in frailer people. So older, frailer people, more likely to be delirious, more likely to have extreme tiredness, more likely to have breathlessness. A third experienced delirium lacked classic COVID-19 symptoms such as cough or fever. So a third of people who became delirious did not have the classic features of COVID-19, therefore in the past have probably often been missed. If people are looking for classic things like cough and fever, well, in a third of patients they're simply not there. The delirium is the feature to look for. And in nearly a fifth of patients, delirium was the only clinical feature. So delirium alone is enough to mean that someone should get tested for the presence of COVID-19. That alone is an indication now for testing. I would say is a logical inference from this new data. Now, Dr. Rose Penfold, one of the lead researchers on this, says watch out for any changes in mental state in older people, which we've just said. Confusion or strange behaviour could be an early sign of coronavirus infection. There you go. Perfectly clear, perfectly obvious. Put in place infection control measures such as, this is not Rose, this was just on the website. So put in place isolation control, increase hygiene, personal protective equipment, make sure this doesn't spread around, log health reports on behalf of friends and family who can't use the app. We've said to do that. Significantly increase the number of older people in the study if we did that. And that would be really useful to get, because the more data that is available, the better. Now, just a brief update on the United States. There's interesting things going on now. I get a lot of emails saying they don't like the quality of the information from the United States. To be honest, it is very hard to tell, but this is the information we have as per live website now. 7.5 million cases officially, 210,000 deaths, 307,000 cases in the last 7 days. And we can see on this site, of course, we can see the trends as well. States and trends, there we go. So we see that there's perhaps a levelling off to a slight increase at the moment in the numbers of daily new infections. So what I wanted to look at though was let me tell you about President Trump first of all. I just watched an interview with him about an hour ago, and of course you can't tell, he's on TV, he's got makeup on, but you do get to be able to some extent look at people and hear what they're saying and get an idea of to how ill they are. So I've been looking after poorly people now for well over 40 years, and you do kind of get the hang of it. So I remember when I was 18, I was in a ward, and I was looking after some patients, and the qualified nurse came in when I was a first year student, and she said, "Oh heck, he's gone blue," and ran out to get someone to help. And I hadn't noticed. It was my first clinical placement. I hadn't noticed that someone had obviously deteriorated. But with more and more experience, you can notice more and more subtle things in people's faces. And I've worked with doctors, experienced doctors, and I'll say, has that person got a particular long-term condition? They say, no, they haven't got a long-term face. long-term disease face. It's not diagnostic. What I'm saying is you do get used to looking at people. And from what I could tell, President Trump looked healthy on his interview this morning, and he attributes this to the antibody therapy he received, and I think he's probably right. Because by rights, you would still expect him not, given the asymptomatic COVID, you wouldn't expect it just to go away, and his has. Now, we can't take any data from that. We need to do this thousands of times. But that antibody therapy he had, the Regeneron antibody therapy, did seem to work dramatically well in one case. Therefore, we need to test it on thousands to find out if it's working. But I think it's very likely that it will work. And he said he'll make it free for everyone who needs it. Presumably means everyone in the United States, but this is a potential massive game changer. It really, really is, because this could be the first truly effective treatment. And the other thing about it is you can give it to, it's not just like dexamethasone where you give it to people that are really sick. Give it to anyone. If it turns out to be efficacious and safe. We really need to move on that. But I was delighted to see you saying you would give it to anyone who needs it, which is remarkably encouraging. Now, moving on to some information. Let's just, before we do that, just got a story from Wisconsin that kind of aroused my interest this morning. Let's just have a look at Wisconsin. There we go. So they're the kind of figures from it there. Now, this story aroused my interest, and I'll give it to you and let you see what you think. So, Wisconsin Field Hospital has been opened up. Now, Wisconsin State with 5.8 million people, and the U.S. Army Corps of Engineers built a 530 bed hospital back in April. So far, so good. So that was built back in April. Now, where am I gone? There we go. Right, that was built back in April. It didn't need to be used, fortunately, so that was good. It's on the state fairground near Milwaukee. Now, the governor there has said the surge in cases threatens to overwhelm hospitals. Therefore, he has opened the field hospital up because he thinks hospitals are going to be overwhelmed. And he says this alternative care facility will take some of the pressure off our healthcare facilities. Makes sense. What he says, 16% of the state's hospital beds were available on Tuesday, 16%. In other words, they're running at an 84% capacity, which is a bit higher than you'd like to run, but I've certainly run at that a few times. Hospitalised patients with COVID-19, 853, 216 in intensive care. Now, this new facility will be a low-level care facility. There'll be no visitors allowed. It'll be staffed by volunteers, state workers, and National Guard. In other words, it's not for the sickest people. It's for lower level care, which is fair enough. Could take the pressure off other areas, other hospitals. All makes sense. Not allowed to have visitors, which also makes sense, I'm afraid. Now, the causes are the reopening of colleges and schools. Coronavirus fatigue, masks and social distancing. Now, I do agree this is a problem. People are just getting fed up of this and sometimes aren't obeying the regulations. I'm sure most people are, though, so I'm not sure that's a big cause. But why this attracted my attention was I'm just a bit concerned that things in the States are being politicised. Now, it's not my role to enter into American politics. I would not do that. But the way that the wearing of masks has been politicised, I think that's changing now. But it has been politicised for one particular political position. It's just ridiculous. We're talking about the science here, and given that there's something going on in America on the 3rd of November, I think it is, and I think the governor is for the opposite party. I'm just wondering if this hospital's being open for alternative reasons, and I'm just thinking aloud here. If I'm wrong, do let me know. And if Governor Evans wants to come on, of course, I'd be delighted to have him to give counter argument. So in Wisconsin, there's been 2,474 cases per 100,000 of the population over the past 7 days, and they've responded by opening this hospital. Now, I thought, well, that sounds quite a lot, and of course it is. But if you look at all these other states, if you look at the other states, you can look through the other states, and I've just made a note of a few of them. All these states here have had much larger numbers and have not opened emergency field hospitals. They're working within their existing facilities. So it just struck me as being a bit strange. I do hope things aren't being done for reasons other than purely healthcare requirements. What would concern me about a new hospital like this is the people that are working there may not have the relevant skills, so it could be quite a significant factor. And the other thing that made me just wonder about this was the hospitalisation data from the United States in general, according to this, is still relatively low. Now, okay, this is always out of date, frustratingly. This is from the 26th of September. But that trend is definitely down. So while cases remain relatively high and deaths aren't by any means insignificant, there's still many hundreds of deaths per day, the overall hospitalisation does seem to be down. So I just thought that was a bit interesting. Just float that for your perusal. So the main thing from this video, though, is it's really encouraging that antibody therapy seems to work. Let's hope we get really big trials going on that, because if we had an effective therapy, that would just change things potentially more dramatically than a vaccine. Okay, thank you for watching as always.